B12 anemia is a condition that occurs when a person's body does not have enough vitamin B12 to produce a sufficient amount of healthy red blood cells. This can lead to symptoms such as fatigue, weakness, and shortness of breath. There are several factors that can contribute to B12 anemia, including poor diet, certain medical conditions, and even drug use. One common cause of B12 anemia is drug-induced malabsorption. This occurs when certain medications interfere with the body's ability to absorb vitamin B12 from the food that is consumed. Some drugs that are known to cause this type of malabsorption include proton pump inhibitors, which are commonly used to treat acid reflux, and metformin, which is used to treat diabetes. When a person takes these medications over a long period of time, they may develop a B12 deficiency that can lead to anemia. This is because the drugs can damage the cells in the stomach that are responsible for producing a substance called intrinsic factor, which is needed for the absorption of B12. Without enough intrinsic factor, the body cannot absorb B12 properly, leading to a deficiency. In addition to drug-induced malabsorption, some drugs can also directly interfere with the body's ability to use B12. For example, nitrous oxide, also known as laughing gas, is a common anesthetic that is used in medical procedures. When a person inhales nitrous oxide, it can inactivate the enzyme that is needed to convert B12 into a form that the body can use. This can lead to a B12 deficiency and ultimately to anemia. It is important for people who are taking medications that can cause B12 anemia to be aware of the potential risks and to talk to their healthcare provider about monitoring their B12 levels. In some cases, a person may need to take B12 supplements to prevent or treat a deficiency. These supplements can be taken orally or administered through injections, depending on the severity of the deficiency. In addition to drug-induced B12 anemia, there are other factors that can contribute to a deficiency in this vitamin. For example, people who follow a strict vegetarian or vegan diet may not get enough B12 from their food, as it is primarily found in animal products. Older adults and people with certain medical conditions, such as pernicious anemia, may also be at risk for B12 deficiency. Symptoms of B12 anemia can vary depending on the severity of the deficiency, but common signs include fatigue, weakness, pale skin, and shortness of breath. In more severe cases, a person may experience neurological symptoms such as numbness or tingling in the hands and feet, difficulty walking, and memory problems. If left untreated, B12 anemia can lead to serious complications, including nerve damage and heart problems. It is important for people who are at risk for B12 deficiency to be proactive about monitoring their B12 levels and seeking treatment if necessary. By taking steps to prevent and treat B12 anemia, people can help maintain their overall health and well-being.